Hello there. I'm jumping on because it's Dementia Awareness Month, so I'm going to take the next couple weeks and I'm going to dive into the different types of dementia. Obviously, our parents are at an age where they might be experiencing these challenges, so it's important to be informed. And seriously, we've been seeing a rise in the younger population being affected. Currently, like on my unit right now, there's 3 people in their 60s with dementia. So it is really tough. But I'm going to do a quick overview of most of the recognizable types of dementia. You may or may not have heard of them. I'll do some signs and symptoms of what to watch for, why this happens, and how you can go get diagnosed. And as I mentioned, over the next couple weeks, what I'll do is break down each type in more detail because there is significant differences between some of them. So it might help you kind of get that going, get that rolling, and figure it out. So one of the most common and most known to everybody is Alzheimer's, but there's also vascular dementia, Lewy body dementia, Parkinson's disease, frontal temporal dementia, Creutzfeldt-Jakob disease, Wernicke-Korsakoff syndrome, which has to do with alcohol, mixed dementia, normal pressure hydrocephalus, Huntington's disease, young onset, and there is actually HIV-related dementia. So some signs and symptoms that you may notice with loved ones could be memory loss and confusion, poor judgment, difficulty speaking, understanding, or able to express their thoughts, troubles reading and writing, getting lost in familiar places, difficulty handling money and paying bills, repeating the same question over and over. I know we sometimes get that even just naturally, but using unfamiliar words for common objects, like it's crazy. Taking longer to complete daily tasks, losing interest in normal activities. They may have hallucinations, delusions, or be paranoid, acting impulsively and without any regard for anybody else's feelings. They lose balance or have trouble with their movement. So why does this actually happen? So dementia occurs when the neurons, your nerve cells in the brain, stop working. They lose connection to other brain cells and then eventually die. Well, neuron loss happens naturally while we age. People with dementia experience it much more severely. Risk factors can include genetics, lifestyle choices, and conditions like high cholesterol. But there's also ongoing research and preventative measures such as physical activity, controlling blood pressure and blood sugar, staying mentally engaged, doing those little games all the time on your phone, and maintaining a social connection is really big. Also something you might want to just prevent any head injuries, so be careful about things in the way. To diagnose, so this is going to involve some cognitive and neurological testing, like brain scans, psych evals, some genetic testing can get done, cerebral spinal fluid testing, and blood tests. So I hope this can give you some insight into what to watch for when you suspect dementia in a loved one. But stay tuned as the days go on. I'll dive deeper into each type and try and give you some more clarity. I know my coworkers and I, we really work closely with dementia. We have it on the unit at all times. Families are destroyed by it, and patients unfortunately suffer. So we know what it's like, and hopefully this information can help you feel a little bit more prepared. Thanks for now. Take care. Bye.